Welcome to the show Talk with Your Doc, and with me is Dr. Adrian Chan. Thank you, Dr. Chan. We were just talking about various risk factors for the breast cancer. One of the risk factor is the breastfeeding. Can you please tell us about the breastfeeding and the relation with breast cancer?
There's some indication that breastfeeding may reduce the risk of breast cancer slightly if you breastfeed for a total of 1.5 to 2 years. It has to do, it's believed, with exposure to estrogen in the body, right? Mm-hmm. There are various hormonal risk factors that are associated with breast cancer. That includes the breastfeeding, but also starting menstrual periods at an earlier age, like less than 12, or having late menopause, the ending menstruation at a later age, at greater than 55, because the theory is that those factors allow for a woman's body to be exposed for a longer period of time to estrogen, which is a hormone in the body that can influence the growth of breast cancer cells.
So now post-menopausal women, they do receive estrogen supplementation or hormone supplementation. Is that hormone supplementation treatment in a post-menopausal period, is that a risk factor for breast cancer?
Some research has shown that menopausal hormone therapy, hormones that are taken to help relieve some menopausal symptoms, can be associated with increased risk of breast cancer through some studies, including major research through the Women's Health Initiative. They showed that in women who took combined estrogen and progesterone hormone therapy did have an increased risk of breast cancer. Though women who took only estrogen alone did not have as increased the risk of breast cancer. But the estrogen therapy alone is usually used mainly for women who have had hysterectomy, because the estrogen alone in itself can increase the risk of endometrial cancer, cancer of the womb or uterus.
Right. So we talked about all these risk factors for the breast cancer. So now how can we prevent the breast cancer? How we can detect it at an earlier stage and prevent it? So you talked about prevention by modifying the risk factors like lifestyle modifying factors, or reducing the smoking, alcohol, as well as screening if earlier if patient's family history has a breast cancer. And we talked about BRCA. Can you please tell us about the clinical features? How can patient know that he or she has a breast cancer?
Sometimes you don't have any symptoms with breast cancer, and it's detected on screening. In a woman who doesn't feel any symptoms, they're well, but the mammogram may show a suspicious finding in the breast. So sometimes you don't have any symptoms, especially if you're being screened. But otherwise, the most common symptoms are some changes in the breast, like commonly feeling a lump in the breast that is persistent, that doesn't go away or reduce in size with time. It may be firm, irregular. There may be some tenderness, but often not a lot of pain.
Is there any discharge coming from the breast? Suspicious?
Well, many things can cause discharge from the breast, from the nipple, and most of the time it's not related to cancer. But sometimes you can have breast cancer associated with discharge from the nipple, especially if it comes just spontaneously and maybe with some blood.
And if the breast tissue is very dense, then it is very difficult to feel the lump or the bump. Then in that case, what is the method to diagnose breast cancer? So if a patient has no signs and symptoms, but she is like 40 or 42, then what is the mammogram? How does it help to diagnose the breast cancer at earlier stage?
If a woman is healthy and does not have any concerning symptoms, then the usual screening for a woman is mammogram.
So can you explain us about the mammogram a little bit? What is it? What sort of procedure it involves?
It's basically an X-ray where they take images of the breast. They compress the breast between two X-ray plates. They take generally two sets of images, one where they compress the breasts, you know, in this direction, another in this direction. And these days it's commonly done using digital imaging, you know, technology, and it looks at abnormal breast tissue, right? Or can identify some abnormal
So it
breast
can
tissue.
diagnose, the mammogram is like an X-ray test which can diagnose abnormalities in the breast at a very early stage, right?
Right, yeah.
Like along with the mammogram, is there any other procedure like biopsy also are done along with the mammogram?
Sometimes if the findings on the mammogram are you know, not clear, they may use ultrasound to further evaluate, to check if the finding is solid or fluid-filled, a cyst. And then if there is something suspicious, you know, found on mammogram and or ultrasound, then often a biopsy with a needle, often guided by ultrasound or perhaps by, you know, mammogram-like imaging, is done.
Now, what are the recommendations, after what age and how frequently one should get mammogram done?
The current common recommendations are for women of average risk for breast cancer to have screening with a mammogram about every 2 years between the ages of 50 and 74.
Okay.
Below the age of 50 for average risk women, it's not as clear if mammograms are beneficial.
Okay.
And above the age of 74, there's also less, you know, research to show if it's helpful. But many women who are of that age or older and are generally fit, you know, can still talk to their family doctors and it would be reasonable to consider them for mammogram screening as well. If women are younger, between 40 and 49, but have high risk, features like strong family history, or are known to be, BRCA1 or 2 mutation carriers, then some screening is recommended earlier.
Yeah. So breast cancer is not a disease of old age. It can happen in young age also, like between 30 and 40 also. So if a family history of breast cancer, if somebody in the family has been previously treated or diagnosed, or there is a history of BRCA1 mutation, screening with mammogram earlier is helpful in young patient, right?
Breast cancer can occur in a wide spectrum of ages, wide range of ages. Age is a risk factor for breast cancer, so as you get older, the chances are more likely that you will get or the breast cancer. And younger women can still get breast cancer even in their 40s or even in their 30s.
30s, yes.
Young women like that, often it raises the suspicion that maybe they do have a BRCA1 or 2 mutation, and those young women would often be referred for at least some genetic counseling.
Right. So even though age is a risk factor, everybody should watch carefully. And so does self-examination help in diagnosing the breast cancer at earlier stage?
I think in the past, self-breast examination was recommended a lot. When they do research on it, it's hard to prove that regular self-breast examination definitely decreases the rate of death from breast cancer. I think what is important in general is to have some, awareness of one's body, right? To kind of have a general sense of what is normal and what is not abnormal, as in general, more than specifically having to do a formal breast examination. Just to have a general awareness of your body and to be able to seek medical attention if there is some changes that you feel are unusual.
Thank you, Dr. Chan. We'll come back after a short break. Please stay back. We'll come back. Thank you.